is Sonny. I'm one of the volunteers for DCCF. As you can see, we're preparing the meal we are going to present to the children. We plan feeding 2,000 children, not just feeding them. The idea is to deworm them, and you know you can't deworm children without feeding them. So presently now we are preparing the meal. What is on fire now is the meat. We're not just giving them piece meats. The meat is big, it's not it's sizable and tasty. Well, this is our chief cook. So we've spiced it, we've marinated it. So that's what's on fire now. So pretty very soon the rice will be on fire, and before you know, everything is ready.
My name is Tolulope Ogunlashe. I'm one of the volunteers for DCCF Mega Outreach. The program was to feed 2,000 children and deworm them. I'm glad to say we had a successful event, and I'm proud of being a volunteer. I encourage a lot of people to come and join DCCF to volunteer for this program.
My name is Ruth Iyokumere. I'm one of the volunteers for DCCF Outreach, Mega Outreach, to feed 2,000 children and also to deworm them. I'm glad to be a member of DCCF. A very nice one. We're able to see children eating. It's such a glad one for me, seeing them eating the food we actually made and we cook. So it was a very nice one. We're asking for more volunteers. We're asking for more people to come and join DCCF to assist us in any way they can.
My name is Nweke Ernest Onyebuchukwu. I'm the head creative of EasyClick Network and Technologies. Got to know about Divine Comfort Charity Foundation through a very good friend of mine and a business partner, Sonny Ogbonna. So he was the one that gave me the details about the charity foundation, and then, you know, being that he too is someone who believes in giving to the society, and I bought the idea of whatever whatever we get from God, we're supposed to give back to the society as much as we can. So that was how I got to know about DCCF, Divine Charity Comfort Foundation. This outreach did better than the last outreach, which I got the information from the people who attended. Then this outreach, because they not only gave food to the less privileged, but they were able to give medical attention to those who required it, and then it was a very good one. I think it's better than the last one, and they were able to touch more lives than before, which is a very, very primary objective of the Divine Comfort Charity Foundation.
My name is Dr. Steven Agboro. I'm a general practitioner. I'm one of the volunteers of the Divine Comfort Charity Foundation. I got to hear about it from one of the promoters, who also happens to be one of my former bosses. Charity and these foundations are things I'm very passionate about. Volunteering is something I'm very passionate about because I like to give back to the society. So when he called me up about it, I quickly signed up and volunteered. Like I said, I'm very passionate about volunteering. So actually when he called me, I was on leave. I was actually in Lagos, but he told me when the program was to start. I immediately consented and said, okay, I had to fly down a day before the outreach, and made myself available to give back, like I said, to the society. The outreach was done at Gasaki, one of the satellite towns in Nasarawa, and there were different aspects to the outreach. There was an aspect of feeding the children. There was also a Medicare aspect. Being a health professional, I was involved in the Medicare aspect. We were involved with taking vital statistics like the weight for age for each of the children. We actually concentrated on ages 1 to 7 years old, and we also gave deworming tablets. And in some cases where we found out that probably the weights were lower than the age, the weight for age was below the percentile or below the normal, we gave some health talks to the mothers, tried to encourage them on how to better improve their health care and their health-seeking behaviors. Of course, there's always room for improvement. I feel that we could expand our Medicare aspects of the program to involve other aspects like malaria. We could probably expand to giving out mosquito nets to the pregnant ladies and pregnant women and the children. And also, I think that we could also expand to neighboring villages and in terms of the health talk. From what I could see, though I wasn't part of the organization, I was only there as a volunteer, but I could see that there was actually some limitation in what we could do in terms of the resources that were available to us. For instance, like I thought about expanding on healthcare, one of the reasons why we could not expand and really go all out in the healthcare delivery was because of limited resources. So we thought among ourselves and looked at did a survey in the community and thought about what was most important at the time, and that's why we chose to do what we did. But I'm hopeful that in the coming future outreaches, our resources will be expanded and we'll be able to deliver a better outreach.
My name is Bulus Esbawa, all the way from Girada, now always known as Piway. We appreciate for the immunization people that came today to cure our children. We want to appreciate them special for their goodness, and I pray that may the Lord bless them in Jesus' name.